I want to thank you all for joining today. It's what Branimir, Vlad, and the informatics core has done is truly remarkable. We're at really the juncture of launching something that was a vision about 3 years ago. Took an enormous amount of effort through our data use and data transfer agreements and in collaboration with our health system, because the health system owns the EHR. We could not have done any of this without the alliance, our alliance partner, who is Robert Wood Johnson Barnabas Health System. The health system's been integral. We have built a data governance that will allow us to, in a very predictable and timely way, address the needs of investigators who wish to study the EHR. This component of NJX is really, again, not only a partnership with the health system and Rutgers, but also with our Office for Advanced Research Computing work, and has been a wonderful opportunity to work together. Ultimately, it's going to be you as a user, as an investigator, who will access this incredible data resource, be able to utilize and leverage it so that you can publish your work, and also ultimately to improve outcomes in health and disease. I mean, that's what we're really talking about. Branimir and Vlad have been here from day one, knows tremendous amounts about the CRDW. I want to call out a special thanks to Michelle Noren, who has worked tirelessly at a very high level in conjunction with Brian Strom, who has significantly contributed dollars, energy, and vision to this approach. I want to thank the co-leads of our informatics group, and this would include Yi Chen from NJIT, also our colleagues David Ferran, Frank Sonnenberg, and Jim Geller has worked carefully on the informatics group, as well as Steve Crystal. So I want to thank you all for your contributions, the contributions of all of the wonderful colleagues I have at NJIT. So Branimir, please kick it off, and the podium is yours.
Thank you, Ray, for this great introduction. So first I wanted to check, do you see my slides? Is everything visible?
Thumbs up.
Okay, good. Thank you. So as Ray said, we'll be talking today about clinical research data warehouse. We'll give you some advices, ideas. We'll try to describe process, how to submit requests, how to obtain data, and give advices what you can do with those data. As Ray said, there is a lot of people who participate in this project. He thanked to a lot of them. I would also thank to the same group of people, and I would like to introduce our team from the Office of Advanced Research Computing, who are involved in this CRDW project, and who are the people who carry most of these workloads when it comes to searching and delivering the data. On the top of this slide, you see a website, web address. That's how you can access this CRDW, and you see contact email, how you can submit your questions if you have something, and ask for advices and help. The team you can see here is only the part of the complete CRDW picture. So this is the org part of the team, led by Vlad Kolodovic. He's the one who put a lot of effort to make this CRDW project working. After many years, we are now happy to offer this big data and is big resource for your projects. Then you see two people, Silaj and Mark, are the people who actually perform searches, who will work in once when you submit your data, and who will you consult when it comes to the real work, to the real searches. And then Travis and myself, who are senior scientists, so we will help you with advices, what to do, how to do projects, how to approach data extraction, and later when you get data, what to do with data. Since Ray mentioned this Office of Advanced Research Computing, I will tell you a few words about the OARC. So that's the University Centralized Research Computing and Data Science resource. It provides big storage, large computing resources. So if you have to do some parallel computing, or if you have some data that require a lot of storage and computing power, that's ideal source to reach out. And we also provide networking capabilities. We provide different training and education. You see here, there is a group of scientists called Research and Education Facilitators who can support your research in many scientific areas. We also provide advices and help for grant proposals. So you see how there are these large amounts of money that we participated in various grants with creating grant proposals and giving you whatever you need when regarding to the computer power and the advices when it comes to computer science. One of the important sources in the OARC space is Amarel. Amarel is HPC computing. It's founded 2017. It got named by Saul Amarel, who was the founder of Rutgers Computer Science Department. And Amarel offers whatever HPC computing system offers. So it's large memory system, provides a parallel computing, vast opportunities for data analytics, artificial intelligence research, and many other opportunities when it comes to the use of large computing processes and large computations. So we have about 770 compute nodes here. And you see on this slide, I will not present it, so we'll share this, what one of those nodes constitute of and how you can obtain. And the Amarel cluster spans through all Rutgers centers, Piscataway, Newark, and Camden. I mentioned that we provide help and support in many scientific areas, and we'll focus now more on health sciences and medical informatics in the rest of this presentation, and we'll refocus back on CRDW. So we support CRDW. We also support RedCap, research data storage, different topics and projects in medical informatics, data science, machine learning analysis, if you have those, AlphaFold, if you do proteomics and protein analysis. And we also, in collaboration with the NGX, provide this education in clinical informatics, where you can obtain 3 badges, digital badges, after you complete the course that constitutes of 3 different sections, 3 different courses, and there are multiple lectures that you can do online. CRDW, this is the starting website. You can see the address on the right side, how you can access this site. So when you access the site, you find the basic information about the CRDW, what's that, and also you can find all these options, how you can submit requests and how you can request for the data, which I will explain a little bit later. You can also find statements from Michelle Norin and Ray already acknowledged her. She's Senior Vice President, Chief Information Officer at Rutgers. She's one who really helped a lot with making this CRDW reality and make it available to researchers. That's done in collaboration between Rutgers, University Rutgers Health, and RWJ Barnabas Health. You can also find definitions and explanation what's CRDW in general. That's a big data repository containing healthcare data, and we'll see in the rest of these slides what you can find there. Current sponsors are Barnabas Health, who is the largest contributor of data. There are, from what I know, more than 20 contributors of this data. Also, sponsors are NGX and Rutgers Health. Now, what you can find in CRDW environment, there is the most important, let's say, for us, and the focus of this presentation is on the electronic health records, EPIC database, which is managed by the WARC CRDW team. That's something that we can help you with. So that's EPIC Clarity database, primarily coming from Barnabas Health Hospital System. You can also find some data sets from Institute for Health, collection of Medicaid, Medicare data that's managed by IFH. Also, CNJ provides collection of cancer-related data. And the goal is, we are working on that to make all this data, bring everybody together under one roof and collaborate more with all these other contributors in one unique CRDW system. Here's the feasibility board, dashboard. It's taken back in January. That's like picture that shows approximately how much data we have there, how many patients. And you will, in the near future, have access to these dashboards once when you submit a request for data, so you can also see this dashboard, and especially dashboard that's related to your data request. So let's explain a little bit what's this electronic health record data. That is stored in Oracle SQL database environment. So it's SQL type of database, in this specific case, Oracle. If you're familiar with the SQL databases, they are slightly different, depends if do you use MySQL or you use Microsoft version or Oracle version. So, but if you're familiar with SQL, you can have understanding what this type of database is. So the most data is comes from EPIC Clarity database from RWJ Barnabas Health, and that's EPIC data from 2018 till now. That is the most abundant source of data. And I mentioned there is about 20 more contributors, but this is the largest contributor. We currently have between 8.5 and 8.6 million distinct patients in that database. The last time when I checked was close to 8.6 million. And the information that we have is that RWJ Barnabas Health contributes, has about 2.3 million annual patient visit during 2023, which means if we assume that some patients visit 2 times, 3 times, but that's probably smaller number. So that's what you can estimate how big will be annual increase of this population in this database. The update is done every 3 months, full update, and most of the tables are updated monthly. And why is that important? Why that spend some time to mention that is, if you request a data set now, and if you find out that you need to do some updates a few months later, let's say 6 months later, it's possible that your results will be slightly different because you may have these 1 or 2 updates in the meantime, and you will have some additional patients. So if you are publishing paper, I mean, I had experience to read papers where authors put in introduction 1 table with certain numbers, and then in conclusion, they put in the results section, they put slightly different numbers, and that probably comes from these updates they were not aware. So that's something that you need to pay attention, especially if you're publishing papers. And also, there were more than 20 projects that are completed and delivered since January, which is significant increase from the previous 4 years when we had only 2 projects delivered. Who can access this data? Access is granted to authorized researchers, clinicians, stakeholders associated with Rutgers University and the RWJ Barnabas Health primarily. And you can assist partners like NGX has partnership with Princeton and JIT. You can help those researchers, include them in project, but PI must be associated with Rutgers University or RWJ, Barnabas Health, and PI is responsible for data management and for external partners. So you have to be certain that this data will be used properly, and they can access data through you, actually join your projects, but currently they cannot have data for themselves. It's a restriction that Barnabas Health put to outside researchers. Before you use data, you have to have IRB approval as well as Data Governance Council approval. CRDW provides 2 types of services. That's data access. So if you want to access the CRDW warehouse that we have now, and data tenancies, if you have your own data and you want to store the data in the CRDW environment, you can ask for that, and we give priority to clinical and medical data at this time. In addition to these 2 services, we also provide full research support ranging from basic consultation, initial assessments, advices, what you can do with data, help you how to set up data analytics, statistics, machine learning, and so on. Here is the chart where we can share how these researchers distributed. 51 was request for data, and we had 12 requests for data tenancy. And most of these data requests are for de-identified data, smaller number, but very close to this. The identified data was a request for limited data sets, which is considered identifiable data. There are different purposes why would you need this data. You can do clinical studies using this data. You can use it for statistical analysis, machine learning, social network analysis, graphs. There's a lot of researchers who do that, especially if you analyze diabetes or kidney diseases, data mining, knowledge extraction, and so on. So we can help you. We are working to develop in the near future this modeling like machine learning and some of this analysis clustering that we can collaborate with researchers in the near future. Here are the steps. This is the best that Vlad and I could come up with. These steps that you need to follow if you need data. First, probably the best way to start is to submit requests for consultation with the analytics team. Then you get some ideas how to put requests, what you can expect, how this process works. Then you can put data requests. But before your data request is finalized, you have to obtain IRB approval and Data Governance Council approval, which is important, and also make sure that your IRB approval and data governance approval requests match with your data request. We had some instances where researchers submit one request to IRB and then different requests to the actual search, which cannot be granted. These three have to match. So whatever you put in IRB request, you have to put the same request when you request actual data. Then we have data search, extraction, transfer, and after the data analytics. So let's see first this consultation data request. How you do that? You go on the website, and then on the website you have these three options. That's basic CRDW website. You see others here. So on the right side you see data consultation. So you submit there, and you will have a questionnaire. You fill it up, and you will hear back from one of members of the team who will reach out to you and give you some advices. After that, you can directly submit data requests for the data, or if you need to store your data, you submit this data tenancy request. Contact, that's what I shared initially, and I will also repeat at the end. That's how you can send email if you have some questions before you submit any of these requests. The first step after that is IRB approval. I will briefly go through these steps so you can have idea what's expected there. So here's the website, and here's the initial screen, what you will face when you go on that website. So my advice is, after I submitted my request, is to reach out for this help, IRB office research Rutgers help. So they will respond to you promptly, probably less than a day. And you will, once when you describe what you want to do with this data, what type of research you want to do, they will advise you, is that feasible to be the identified data set research, or where you can get self certificate, or you have to go through the process that requires description of identifiable data. So they will explain to you in the email, and then they will offer to you, they have like open house hours where you can join the meetings and meet with them directly over the Zoom and ask questions. So they are very efficient. Like, I was very impressed. Like, they transferred me to people who know exactly what I was asking. So there was very efficient explanation. So if you follow these steps, you will resolve your IRB questions quickly. So as I mentioned, there are more options. You will find more details on the website, but here I will just focus on these two basic requests. One is if you are looking for identifiable data, which is so-called limited data set, you will click this option and you will have some questions that you will have to answer, and based on these questions and answers, you will get recommendations, and sometimes you will complete that online. Sometimes you will have to talk to some people and submit additional information, but you will find everything on that site. And as I advise you, if you ask for help, and you will get all these advices very promptly, and you will be sure that you complete it the right way. And if you qualify for this de-identified data, then there is self-certification tool. You click on this option, and there is a self-guided process that you can complete, and after that you will have your certificate. Here, these protected health information identifiers, which are considered identifiable. So if you want to have the identified data set, that means that you will need to have all this data removed. So here is this 18 on the list, 18 identifiers, and we provided you also link to the website where you can find more details about these identifiers. So if any of this is present in the data, that will be considered identifiable data, and there's a separate process for identifiable data than for de-identified data. And the way how this process works, once when you submit for non-human or de-identified data, they will give you 8 scenarios. Here I put one, it's not very visible, but it gives you some idea what you have to do. You will go through these scenarios. You have to read instructions and select, does your intended project match or doesn't match with this. And if you, at the end, qualify after all these 8 questions, scenarios, then you will get your self-certification approved, so you can print it and submit it with your data request. If you don't qualify after these scenarios, then you have to go through the process for identifiable data. After you obtain RB certificate, if you are looking for de-identifiable data set, you can obtain this very quickly, like within 1 day, 2 days. So you can fairly quickly submit your data. And then the next process is to obtain Data Governance Council approval. Important to say here is that, according to my knowledge, Vlad can help more later. As I know, they meet once per month, and then you have to submit your request as early as possible, so you can qualify for the first following meeting. So you don't want to wait too long, but you have to prepare complete data. So that is now completed over DocuSign. Once when you submit request, you will get this DocuSign invitation to fill up these questionnaires and submit them. There are generally 3 types of documents that you have to fill up there. That's data access and use agreement. What you need to do there is to describe exactly what is your project, what will you do, what do you need for the project. Then you also have to describe how will you destroy data after the end of the project. Now you will have prepared form and text for most of that. Expect those specifics that you will use for your project, but for these general statements that you have to accept, you will have now prepared text, and your submission will be easier. Then you will also select the storage and computational configuration. What do you need? We offer virtual machines and these other options where you can extract data, and then there will be some brief cost estimation, what you can expect that you will be responsible for after you describe what you exactly need for your project. So you submit that, and once when you submit it, usually during the next month, or if you submit early in the month, current month, then you can expect even during the current month to have your project reviewed and approved if everything is okay. Or you will get questions if you have to add something, explain something. Next part will be data search and extraction. So here is one example that we used there. That's approximately how this request look like. On our side, you will have fields to describe your project. So here what's requested, hypertension and comorbidities. Objective was to do some machine learning and this other computer science analysis. So you describe your project, the general de-identified data set, what's the purpose, what's the disposition requirement, what kind of patients you want, you put in your text, age, what conditions you want patients to have. So duration, you can specify duration of the project. So that's something that you can expect to describe. As you know, what is electronic health record? You will find in this CRDW whatever you have in EPIC. So those of you who work with EPIC as clinicians, whatever data collected there, you can find in the CRDW. Now it depends on do you want the identified data or you want identifiable data. So you have to specify and get appropriate approvals. But major columns and let's say major categories that you can count to find here diagnosis. So you can request your searches by diagnosis. Let's say you want diabetes or hypertension, or you want combination of couple diagnoses. And then procedures, medications, labs, those are the most often searched categories. So if you want to do diagnosis, you will use this ICD-10 codes or names of diagnosis. Some older diagnoses that are like earlier, before ICD-10 was active, you can use ICD-9. Some small number of patients is still ICD-9 coded. Then procedures. For procedures, you can also use this ICD-10 codes, names, or current procedural terminal CPT. For medications, you can put names, you can put GPI, generic product identifier, or you can put NDC codes. And for labs, you can use names, numeric values to find what you want. So let's focus on diagnosis. Here is some examples of ICD-10 codes and what actually belongs to each code. So it's important if you are looking for certain data to specify what you exactly are looking for. Are you looking for primary hypertension? You have to give that code, or you want to include all these types of hypertension or all these COPD problems or asthma or whatever you're looking for, diabetes. Do you want type 1 or any type or type 2 or heart conditions? So here's the example of that query code. So you put, like if you want combination of primary and secondary hypertension with one of each of these, like with asthma, with COPD, or you can describe that in using names of this diagnosis. So the more you provide, the better. It will be easier for search people to find diagnosis. So if you provide the name and the ICD-10 code, they can easily identify what they're looking for. Medications, here's the example of medications. It's not very visible, but I can explain to you. So for medications, you can use ID names, or you can use NDC codes or GPI codes. For example, if you want to find lisinopril, and if you use NDC codes, you have to be aware there are different doses, and each of these doses have different NDC. Or if you put lisinopril in general, then this is what will you get. This is all lisinopril that you have. So there are like 20, 30 lines that belong to lisinopril. So if you are looking for specific doses or some specific manufacturer, or if you're looking for generic, so you have to be aware of that. You can describe using names, or you can use some of these codes to make search more precise, more targeted. Labs and other parameters. If you want, for example, to study A1C levels with diabetes or blood glucose level, you can specify that. So you can write like this. You can also specify age that you want, 45 to 65 or above 65 or below 30. Then you can specify, do you want male or female? There's most of patients in this database have determination male or female. There is about 100 patients from what I know about that number that are in transgender category. So that would be breakdown, and there is certain small number without identification. Here you see on the bottom this table what you can expect to find. So this female sex, and you can find age. And if you want to specify labs, for example, you want under a certain number, you want above 183 milligrams of deciliter, you have to specify units. So in this database, I found milligrams of deciliter, and these are measurements. So you can specify specific value or value range if you want more targeted data. So additionally, you can limit those searches. For example, if you want to do some statistical analysis, machine learning, data modeling, you can specify that you want patients to find only patients who had 2 or more visits to doctors or hospitals, whatever is registered. But you will have a little bit of discussion here with the search team, how to actually count these 2 visits, because sometimes you visit doctor one day, but then doctor orders for you labs and let's say ultrasound, and they are done the next day. So don't count those as 2 visits. That's basically one the same visit. So you have to clarify that with the search team. Also, you can limit these searches to certain period, like 2018-21, certain age groups, sex, or you want only from one institution. And then in the end, you see when you combine all of this together, you can get complex requests. You want diabetes with A1C level and age between 45, 65. So you can describe that in plain English, or you can put some examples of queries. So the more detailed you are, the better. They will understand easier. And during those consultations, you can clarify some of these explanations better. Then once when you have extracted those data, you will have to transfer your data to certain storage space where you can do analysis. One of options is to do on virtual machines within the CRDW secured environment, which is the requirement if you are using these limited data sets, identifiable data. You will have to store your data on these virtual machines within Citrix environment. And you have options to use Windows or Linux virtual machines. You can select that, and this is like how that screen looks like once when you have your analytical desktop virtual machine. Then other source is you can extract data to other resources. One of advices is to use AMREL that I mentioned initially. That's HPC computing. We have, you see, almost 6,000 students and researchers who use AMREL that provides very good options for storage and computational power. And it's also very good alternative for you if you're using this de-identified data set, especially if you have a lot of data. Data analytics on virtual machines. So once when you have those virtual machines, that's basically your desktop or laptop, whatever you consider, where you have the same screen like when you start your own computer. So you see you have these 1-2 icons that are they point out to your data. So if you click on these 2 icons, you will open your data, and then you have installed programs that you use for analysis. On the right side, you see what is pre-installed, but you can talk to the team once when you request and you have data extracted, and then you can add software if you need, but you cannot install by yourself. You have to request installations, and we have team who installs data. So you have basically Python, R, SPSS for statistics. You have Microsoft Office if you need that. So you have solid Abo programs already pre-installed, and you can add basically whatever you like if it doesn't require licensing. If it requires, then we can work with that. So advices for data extraction. It will be good if you obtain data in tabular as table-like structure and CSV format, or one of those two. You will talk more with the extraction team what will work better for you out of this. So these are data that you can basically load in any program, Tableau or CSV, and these are suitable for analysis in any program. Or you can, even if you are using SQL, work with us and obtain your data as a database. And then the last issue will be there are some fees associated with that. So do not be afraid of this. We can work with you and help you with that. So if you're looking for de-identified data, then that's not very high cost. It's about $500 one-time payment. If you're looking for identifiable data, limited data set, that requires a little bit more work, requires more computational resources, because you have to remove those 18 identifiers, PHI identifiers that I mentioned before. So the cost for that is slightly higher. And then you have to store that, as I mentioned, on secured virtual machines within CRDW space. And then you have to have some small payments for that virtual machine space. But you have all programs installed there that you can use. So that's advantage of having virtual machines with us. If you are trainee or junior faculty, we can work with you to help you with some accommodations, what we can do related to the cost. A lot of you will ask us about grant applications. We already had help to some people. So we have provided in the past letters of support. We provided within those letters of support, we provide description of data set, description of server or security description. So whatever you needed from us to describe about CRDW that you need to put in your grant application, so we can help you with that. We have some prepared forms, but we will also work with you to address your specific needs, so you can expect from us that we'll support your grant application and help you also with the analysis if you need some support and explanations from our team. Okay, I was trying to complete this relatively on time to leave some space for questions. So again, this is the website and this is the contact email. And now I will stop here and ask if you have some questions. So you can ask now. That will be all that I have at this moment. So I don't know what's the best format. Maybe you can, I see we have in chat some of these questions. But before we move to questions, I will ask Dr. Panettiere if he has some here ideas, instructions.
Yeah, no, you know what? I think I just want to say thank you, Branimir. That was a yeoman's task in going through soup to nuts, how we can use the CRDW. And, you know, everyone, I wish I could tell you it's all wrapped up with a pretty bow and it's all going to work. But, you know, frankly, a lot of moving parts. We have a little bit of beta testing here. So please be patient, but you can understand the incredible value proposition bringing this to bear. So we will, you know, cut our teeth on this first iteration. For questions, we only have about 10 minutes left. What I would do is if you could put them in the chat, we could cover some of these pretty quickly. And then we'll wrap it up about 5 minutes before the hour to give Branimir and Vlad a rest. But let's do that. And what I'll do is ask the questions, Branimir. I'll try to bundle some of these so that we don't get redundant. So one question is, if we just need a de-identified data pull and no further services, is that just a one-time $500 fee? Let me also make a point here, is these fees are still, we're still in the process of making the fees. We tried to be as accurate as we can on November 22nd, 2024. We recognize that things vary. I do want to philosophically mention important aspects. Trainees, that would be postdocs, junior faculty, newly appointed faculty, we're trying to do a coupon system where there will be a discounted fee for service. Our goals here is to develop careers in, and we don't want to encumber you with costs. We do, though, have to have some sustainability for more established investigators who need a data pull, who are applying for a grant. Our goals would be, and our desire is that we can do that for preliminary data, but you should incorporate OARC and colleagues as a line item in your grant. Because if you're going to do this frequently, A, you want the support of experts, and B, we need to have a sustainability, and you build that into your grants would work. So let's take that first one. If you just need de-identified data pull and no further services, Branimir, is that $500 or what's your?
Yeah, that's correct. I will
Yeah.
take this one. So yeah, definitely. Yeah, it is just one-time fee. So it will be up to 10 hours of data extraction if it's a simple request, and just one-time transfer from CRDW environment to your computer. So yes.
Okay. And there's another question. Is there any relationship or similarities, differences to be aware of between this asset and use case and that of IPHD, the Integrated Population Health Data Project at Rutgers? I can't answer that one, but Vlad?
No, I'm not familiar with IPHD. So if you answer it, please go ahead.
All right, so we need a translator for IPHD to help with that one.
So, Larry, IPHD is access to it is controlled by a committee, and there are scholarships in essence available to work on it and things, but it's all through the Center for State Health Policy. So it's a very different data system.
Okay, so very differently. Thanks, Larry. Should an individual want access or want to find out more information, how do they do that through IPHD, Larry?
What's that? I would to Joel Cantor or Margaret Kohler
Okay, very good.
at the Center for State Health Policy.
He put a link in the chat too, if anyone wants to hit the link.
Okay, great. Thank you so much. Is there financial health insurance payment data? So we're talking about claims available in the claim data. This is, I think, more a CMS kind of question, but Vlad? Brandon?
Yeah, so for CRDW, we don't have any financial information from Barnabas Health System. So
Okay,
no,
yeah.
unfortunately not.
So the payment data is going to be, and that would be requiring a linked database either through CMS or through the largest MCO in New Jersey, which would be Horizon. We have done that, but it's really on a case-to-case basis. Does the CRDW include data related to the EEG?
I mean, Mark Salaja, are you still with us? So do you have any information?
EEG, meaning
Electronic, yeah, the
Brain
brain, yeah.
yeah, if it, what you mean, the procedure?
Yeah, so
Yeah,
EEG, you know, there'll be probably a report in EEG. I don't know. It's probably a PDF form, so I don't know if you
we
would
have to check this specifically, like
Right.
It sounds like which specific institutions and departments contribute how much of this data, so you can reach out to us and we'll check specifically for you. It should be there, like if it's that department involved, it should be there, like.
Right, but if you are talking about images, we don't have images.
No, it's not image, it's just description. We don't have any images.
Yeah, this is, yeah, no images. There is through CI&J genomic data, But as presented, that is not available currently. Will these slides be available after the presentation? Everything's immortalized here, so we are recording it, and we intend to update this on a frequent basis. How frequent? Probably every 6 to 8 weeks. Things are moving quite quickly, but we intend to have this in a nimble and transparent way for everyone's abilities. Maybe the suggestion, Branimir, is we
We can
can,
definitely share slides. I don't have any.
yeah. So
We'll
maybe we
share
can
slides.
put,
We just need to see where exactly to put them. So
yeah. I think we can put it on OARC, and we can
Yeah,
also
OARC.
put it, I would offer on our website at NJAX access to the slides. We certainly.
so
can
if
put-
you look like CRDW ARC, you can find slides there, and then GACS. So you will find slides on both of these locations.
Yeah. How are unfunded research projects for Rutgers researchers intended to interface with the CRDW, and who would supply the $500 for the data pull? You know, I think unfunded research investigator initiated studies depends on the goals. You know, if the $500 could be provided by your unit could be a division, a department, or a school, that would be fine. If this is going to be as in a grant application, then again, as I mentioned, there's some free consultations, abilities to do preparatory research. That is data pulls that are preparatory to research. But the goal here is that we would like to have this as a sustainable resource. We tried to make this a nominal amount of money. We realize any amount of money does put some burden on everyone, but you know, we hope that people can at least find this. If you're really strapped, and reaching out to OARC or NJAX, we could see what we could do. You know, the ultimate goal here is not just to, gee, I wonder if ... right? The goals here is scholarly activity. So the goal would be a publication, a metric of success, a follow-on funding, grants, or a tool that could be a commercialization of an academic asset that helps patients. So, you know, this isn't just I wonder if kind of question. If you're really going to be doing research, then we look forward to metrics of success for that research. And are the costs billed per project or per export? For example, if a study will require annual exports for 5 years, will it be 5 times, for example, $500? The subsequent exports will be the same structure, but essentially an updated the data. That'll be our last question, ladies and gentlemen. Branimir, Vlad, any great?
Yeah, so it's yeah, I answered in chat already. So it's expert based. If it's just one request, and it requires like 5 hours of ETL time, so then that is the cost. If you need an additional request, so it's hourly based, and whatever data you requested, we will kind of like provide you, estimate how much it will cost.
Great. Well, with that, I want to bring this webinar to a helpful and happy conclusion. I want to thank Branimir and Vlad. Fabulous job. We're really excited about this opportunity and asset. I hope everyone on the call, you know, we were able to answer your questions. If not, then certainly send them along to me. I'll send them to the powers that be. But again, Branimir, Vlad, fabulous job. And thank everyone and NJX colleagues. Have a wonderful weekend. So long now.
Thank you so much.
Bye-bye.
Thank you, everyone.
Bye-bye.